All right, we're talking about a pinched nerve, why it causes pain and tingling into the arm and hands and fingers sometimes. So a pinched nerve is just nothing more than a pinch, but what's usually causing that? So if we have a lot of arthritis in the neck, it could be a bony impingement where it gets very narrow to the space here. If it's a bulging or herniated disc, that can also pinch the nerve. And so depending on what the cause is, really depends on what the treatment is. You can think of it as just like a circuit breaker panel. If the circuit was to go off, the lights and sockets wouldn't be working. Now, if I add a little compromise or a little bit of pressure to a nerve, we might get some symptoms. And if we get a lot of pressure on that nerve, we'll get more symptoms. Usually in the sense of tingling, there's a lot more pressure on that nerve and it's been there for a lot longer for it to occur. So when we're doing a physical examination on a patient that we suspect that there's a nerve compromise due to a bulging disc, we will do a few different things. The first thing we're going to do is we're going to do range of motion because we really want to see how the patient moves. It's very telling. Even getting the patient up out of the chair, we can tell whether the patient has a bulging disc by the way that they're moving. There's usually a posture where they don't like flexing forward when they have a bulge or herniation, and bending back usually feels more relieving. So when we're looking at the patient, that range of motion becomes important. After that, we'll do a nerve evaluation. So we're looking at strength, we're looking at reflexes, and we're looking at sensation. When we put those together, we can kind of see a pattern of what nerve root may be compromised with that. So if we're starting to see, oh, the reflex is diminished, yet the strength is diminished on the same cord level, and then there's a sensory thing, maybe some sciatica or pain going down the arm, down into the numbness into the fingers and hands, then that kind of adds up and we know with very high degree of certainty which levels that's occurring at.